We hold a super high standard of care when it comes to providing any sort of treatment for our patients. We accept 24 dental hygiene students a year, and we have 2 classes currently of first and second year students. So it's very busy.
I grew up in Bloomington, so I've always known about Normandale. And at first I did cosmetology, and I realized it wasn't for me. And I really wanted to get into the medical field, and I really looked into dental hygiene, and I knew that Normandale had it, so I was lucky to get into the program here.
We're a 2-year program, and we educate students to become dental hygiene professionals. Throughout the program, they have didactic or classroom work, both online and in person, a variety of labs, and then we do have an actual dental hygiene clinic where we do serve the public.
We're a community health clinic, so we are really closely tied to the community. The cost is very low. You're helping us learn, and we're helping you get a good foot into the door about dental hygiene.
The services that we offer here is what you would think of as your standard dental cleaning. We also offer what's called periodontal therapies, so scaling and root planing for patients who have gum disease. And then we also offer radiographs, so we take traditional x-rays here with sensors, and then we also take panoramic x-rays. So we're able to send those to a dentist, which is really beneficial because we can offer those x-rays at a lower price. We also do sealants here, which is something that a child could potentially need to prevent cavities. We also do whitening here, where you can get your teeth can have impressions made, and you get trays made by the students, so professional whitening.
One of the things I enjoy most is just working directly with my hands. Instrumentation, cleaning people's teeth. I really just like the aspect of clinical work, and I also love doing radiology, taking x-rays, getting those great images.
I really like that one-on-one connection with patients and really educating them on their dental oral care, because a lot of people are unaware of what they need to do or how to take care of themselves.
I teach the first year dental hygiene students, and I just had this conversation with them last week about their soft skills. So learning how to interact with patients, because it gives them such a different perspective that every single person and interaction is going to be so vastly different. No 2 mouths are the same, not only from an anatomy standpoint and a disease standpoint, but also from a personality standpoint, a cultural standpoint, all of the different aspects that people can bring to the table.
And I've also had the opportunity to see a lot of Spanish people in the community, which they find difficulty finding other Spanish speakers, so I've been lucky to help them too. It's important, I think, because there's always a miscommunication, especially if they're being told something in a different language. They don't understand, or they don't know what the person's talking about. So being able to really talk to them and let them know specifically what they need to do or what's going on in their oral health.
We do have students, about 1/3 of them, that speak an additional language to English. Some speak more. We have about probably 8 or 9 different languages that are represented here in our clinic, which is a huge asset to serving our community.
And it truly does set Normandale apart from any other program in the state.
I would say please use this resource. We would love to have them. It helps us a lot, and we're able to help them start with their oral health care as well.
We would love to have you as a patient at our dental hygiene clinic at Normandale Community College. Please visit our website or give us a call to schedule an appointment.